This is really urgent now. What we're told this morning is that we may be looking at 50,000 cases within a few weeks. I think it may be going faster than that. And, that would translate into hundreds of deaths. What we're witnessing is legal killing. What we've witnessed was legal killing of thousands of people, and it looks as though we could be on the verge of doing it again. These last few days have taken me right back to those early days, the end of February, beginning of March, when some of us tried to draw attention to what was coming down the track and were ignored, denigrated, and abused. We've got to come together. We've got to tackle this as a community. We need leadership. The government has sadly been dysfunctional. It's been lazy. It's been slow. It's lied to us. Trust is a fragile thing. It's like a piece of porcelain. Once you break a piece of porcelain, you can't put it back together again. It's very difficult. To do that and then to turn around and blame the public when you've had a bull in a china shop breaking the porcelain through incoherent, lazy approach to a major crisis, it's beyond comprehension. We need some humility, we need some admission of failure, and we need a fresh start. Well, it feels very much like March all over again. Here we've got the Chief Medical Officer and the Chief Scientist being put up on their own without the Prime Minister. Have they taken the initiative? Are they wanting to now get on the front foot, having been on the back foot for the first several months of this pandemic? Or are they now being put as a shield again in front of the politicians? This is what we need to know. They're owning up to 4,000 plus new cases a day. So you can probably at least double that, given the numbers game that's gone on throughout this, with always playing down the numbers, given the variability in the testing, given how long it's taking for the test results to come back. So there's a lag there. Except for a moment, it was 4,000. That may be last week. It may not be the previous 24 hours at all. So this idea, they're telling us now that it's doubling every 7 or 8 days. We don't know whether that's true. It may be doubling in less days than that. And when we cast our mind back to early March, it was doubling every 2 or 3 days. And the impact of that, when it comes to people developing serious illness, people being admitted to hospital, and then maybe 3 weeks after contracting the virus, people dying in hospital or in care homes or indeed at home, then I've been looking back at my log, which I've kept throughout this thing, and I see that on the 12th of March, there were 10 deaths. On the 21st of March, there were 237 deaths. 10th of March, 10 deaths. 21st of March, 237 deaths. Now that's reported. I mean, that was what they told us. Of course, we now know they weren't counting the care homes and they weren't counting deaths at home, but it had gone from 10 to 237 in 9 days. I think at the moment we're in double figures, but it's coming up. And what they did report, the Chief Medical Officer and Chief Scientist this morning, is that now hospital admissions are going up. So we're in the same sort of territory as we were in March. Remember that awful week beginning the 9th of March, with the Cheltenham, with the Anfield game, with the row over herd immunity. No mention of that by Professor Vallance today. Professor Vallance admitted that only about 8% of the population have actually had the virus, and the majority of people haven't, so that everybody's out there is still susceptible to having it. And interestingly, throughout this entire conference this morning, no reference back to these numbers from March and April. There was comparisons with Spain and France, which is interesting since until now they've been very unwilling to make comparisons with other countries. They're really trying to tell us that we're 4 to 6 weeks behind Spain and France. That seems unlikely. If you remember last time in February, March and April, we turned out to be 2 weeks behind Italy. But there was no mention of the previous picture. In terms of looking ahead now, it's as though the first 6 months never happened. And what we're being offered is a picture of a new epidemic and thinking about it by comparison with some other countries, but thinking that there's a lag here between us and France and Spain of maybe 6 weeks or so. To summarise, I think what the Chief Medical Officer and the Chief Scientist are telling us is this: we're in a bad situation. We need to get a grip on it. They're still not prepared to tackle the issues that are at the heart of this, which is poor political leadership, the breakdown of trust between the government and the public. So particularly young people have been ignoring what they needed to do. At this age in life, you want to be out and about with your mates, with your girlfriend, your boyfriend, and all of that. Taking them with you really required a trusting relationship from the government built on people behaving themselves, not doing the Dominic Cummings thing of running off to Durham and then not apologising for it. So rebuilding trust is very important. The Prime Minister needs to reach out and strengthen his team. He's surrounded himself with Brexiteers rather than more capable people in the Conservative Party in Parliament. He needs to do what Churchill did in the Second World War, which was to build a coalition across the whole of the House of Commons with the other political parties. They need to give away the control to the local level. And he needs to own up and say, we got it wrong. We need to listen. We commit to being honest and open and stop fiddling the numbers. And we want to really do this, everybody working together. It's what I've said all through this. It requires social mobilization. Everybody's got a part to play, but people will only muck in and do what they need to do if they don't think they're being taken for a ride. The second thing is everything continues to come back to testing, tracing, and support for isolation. And there's the fact that we still haven't bottomed this. We need to give over the responsibility and the resources for the whole programme to the local directors of public health and the local National Health Service working together because they know their populations. They've got labs in hospitals. You've got labs in university departments that can be used. These 4 lighthouse labs have been a catastrophe being run by Deloitte and Serco, but the government is so infatuated with the private sector, doesn't believe that the public sector can do anything, even though the limited amount of testing that's being run from the local level has been much more effective at doing the contact tracing than the private sector. There are all these networks of chums getting multi-million-pound contracts. Somebody in the Sunday Times, I think, said the meritocracy is dead. When we look at this woman, Dido Harding, taking charge of this, that's not on merit, it's on chumocracy. There's a story in the weekend paper about one of Boris Johnson's half-siblings being involved in a new company, getting a big contract. They're all related to each other. They're all in the tight networks, getting these £1,000,000, £1 billion contracts. This is abuse of public money. What we've witnessed was legal killing of thousands of people. And it looks as though we could be on the verge of doing it again. The other thing is the political slogans. Well, I've got a slogan for today. My slogan for today is slogans aren't working. We need to get past all these political slogans. What we need is good factual information. Now, to give them credit, I thought that Professor Whitty and Professor Vallance today on that front gave good data. They gave a sense of what we've got and what might be coming. I think it would have been more honest of them to have admitted that they didn't really do what they might have done earlier on. That might have helped to build some more trust and confidence in what they're now trying to do, because we do have to get behind them. Sigmund Freud spoke about denial, one of the defense mechanisms that we have against difficult circumstances. When you look at the Prime Minister on television, you can see denial in his eyes. He's in denial about what he's done, what he's failed to do, what's happened to the country on his watch. But there's lots of other people in denial as well. And we've got to somehow draw back from denial, face the reality, and let's get together and sort this out. This is an 80-20 issue. 80% of the population are supportive of these measures. It's 20% who are very subversive. Older people are more supportive than younger people for the reasons I've said. We need to make it easier for younger people to go about their lives by being able to test them if they're in vulnerable positions at work. All people who are in vulnerable positions because they're public facing in nursing and medicine, in care homes, taxi drivers, bus drivers, shop workers, all these people who are in public facing situations need to be able to get regular testing. People who don't need regular testing are the actual patients in care homes. And those of us who are shielding at home, we don't need regular testing if we're properly shielded. The contract, the deal, is that the testing needs to be in place. The other side of that deal is then that people who are allowed to go out and move about and do their thing have to stick to the rules, the personal hygiene, the social spacing, the face coverings, mask wearing, and so on. That's the deal. There are some things which are completely crazy, I've touched on before, like allowing casinos to reopen. If you've ever been in a casino and you see what happens, people crammed around a roulette wheel, getting their free drinks, getting inebriated, losing their money, and getting emotional, and presumably spreading the virus. Now, a lot of the outbreaks over the summer have been in pubs. This virus likes overcrowding. This virus likes places that aren't well ventilated. It likes people to be hugging each other and lovey-dovey. We need people to be able to have their intimate personal relationships, but we need to be putting them in a position where they want to play that safely and where they want to accept that responsibility towards each other. But at the moment, they've just given up on that. I mean, there is this proportion of the population. I've said it before, there's always been a few percent who've been against vaccines. There's always been that population, but that proportion has got bigger because the skepticism's been fed by bad behaviour by leaders, or so-called leaders, and by inconsistency from the Prime Minister and from celebrities and other people who really should have been setting an example. And we need people to fall in with that. I think fining people £10,000 is an indication of how we've lost the plot, because it's all become much more authoritarian when what we should have been doing was taking people with us by treating them as adults, being open with the data, not playing fiddle in the numbers, and not over-promising and under-delivering over and over again. What's really worrying is people who are saying this is all overstated, we should just let it run its course. Remember, take it on the chin. Was that the Prime Minister early on? Take it on the chin. I mean, he's not looking good. I mean, and that's several months later. We know that this virus can impact people, can cause kidney damage, liver damage, heart damage, brain damage, probably other parts of the body as well, including with people who didn't have it very badly. And this will possibly stay with them for years or decades or for the rest of their life. And it will provide an additional burden on the National Health Service. This all has to be taken into account. I believe that the mental health impacts of this haven't been properly assessed yet. I think that if we go through another round of this now, this is going to be a major mental health crisis. We know from the point of view of serious mental illness, with people who are predisposed, that there have been big pressures on the mental health services. They're struggling. But at an ordinary population level, the anxiety level, the depression, the loneliness, the isolation, there's no talk of that. The mental health services are still grossly underfunded. All the attention's being placed on the hospital end, not on the community end, because the answer to this isn't psychiatrists so much. A lot of it's about community groups, community organisation, self-help, self-support, but it needs an injection of resource to help to support those initiatives. Nobody's really talking about that. We need to get into that because the price we're going to pay is enormous. We've seen in recent days the way in which Kirstie Allsopp, who's got herself a nice little number on the television. She comes from a very comfortable background, very well connected, belittling this virus and its impact. Fortunately, Michael Rosen, who's one of our great national treasures and who nearly died and was in hospital for weeks, came back in a way that only he could do and put her back in her box. And Michael Rosen himself, is suffering the long-term effects, which we're going to see lots of. This happened in a different way after the pandemic in 1918-19, where there was an epidemic of Parkinson's disease years later in some of those who'd been affected, because that flu virus seems to have affected the brain. This virus can also affect the brain. It's nothing to make light of this. This is a serious matter. We need to keep it out of the population. We need to squash the Prime Minister's sombrero completely flat into the ground. We need to get to grips with this. We need to do it without compromising the economy as far as possible. But that means really doing public health properly in order for the economy to survive and to be able to prosper in the future. The first cases back in March were among better off people who'd been skiing in Italy and Austria. presumably they were reasonably well nourished, and presumably many of them just had a mild illness. Now, this virus is now well established in the poorer parts of the country. It's really established in the northeast and the northwest and some other areas of disadvantage. We know that people who are particularly vulnerable include people who are obese, people who've got type 2 diabetes and other long-term conditions. So it's not the well-heeled from the home counties who got the virus first of all in March. So what will happen to 50, 60, 70-year-old people with diabetes in the northeast once the virus is circulating around? Will they shrug it off? Will they be able to benefit from dexamethasone, which has improved the outcome of people going to hospital? It's not stopped it. It still means the majority of people on intensive care are quite likely to come to grief. But will there be a bigger toll of people in the north of England as this virus really goes through the older people, not necessarily the very old people? We don't know. And that's why we have to treat this virus with ultimate respect, why we've got to get everybody back on the same page, and why the government's got to start being open and honest and stop the flippancy, stop the sloganizing. Let's set an example and let's do what Churchill did in the Second World War of reaching out to everybody in the country to do their bit, not telling them what to do and not changing his mind every 2 or 3 days. But we need consistency, we need coherence, we need leadership. I remember when I was a child, we still had the blackout blinds as curtains, because in the war you weren't allowed to have any light onto the street or you'd be in trouble. They used to have the blackout up every night or they'd be fined, driving. If you had a car, they had to drive it with very dimmed headlights so that if the bombers were going overhead, they couldn't see and bomb you on the road. People had to fall in with the rationing. Even if you were a farmer and you had your own meat supply and eggs and everything, you had to put it into the community supply chain. You couldn't hold back stuff for yourself and your family. I think the individualism that began in the 1980s has pervaded the society, and it's become an unhelpful side. It's not taken over. It can go either way. What we saw earlier on in this was how communities and neighborhoods organized themselves spontaneously, but the forces of evil, if you will, wanting to just get out there and be anarchistic, no discrimination between activities that are essential and activities that actually need to be controlled. I mean, you look at the fuss over football matches and so on earlier on. The public wanted the games and wanted mass events stopping, but the government was unwilling to do it. I mean, Prime Minister wanted to go and watch his rugby match at Twickenham, didn't he? The Saturday before they were finally pushed by the public into lockdown. Normally when we've had these kind of things in the past, people have trusted previous chief medical officers like Liam Donaldson, like Sir Donald Atchison. Unfortunately, this time, I don't think the chief medical officer and the chief scientist did themselves any credit by holding back and pulling their punches at the beginning of this, rather than confronting the politicians with the reality and not being allowed to be used as patsies. It was only after the Prime Minister had told Whitty and Patrick Vallance that they were not allowed to comment on Cummings' escapade to Durham, that then one of the deputy chief medical officers, Van Dam, broke ranks, if you remember, and said that he believed that the rules about lockdown and travel and everything applied to everybody. And the chief medical officer had said nothing. The chief scientist had said nothing. They didn't do themselves any favors, because we need to be able to trust people, particularly in this environment where the government has tackled it in a highly political way rather than in the scientific way that they claimed to have used. I mean, the real science, the public health science, is about the flotilla of small ships, the doorstep epidemiology, the local public health teams who've been controlling epidemics and outbreaks for 200 years. You can't do this from a call centre in Milton Keynes or somewhere. I think the schools and the education system, the colleges, the universities, there's a really good case for getting them back on track. But how we get them back on track is the key question. In the big office-based corporations, the banks, the insurance companies, these kind of outfits, they've taken a view that they don't want everybody back in the office till next year. A lot of them are saying they only want about a third in on a daily basis. Otherwise, they can be working at home. Now, this seems to be a sensible principle in terms of social distancing in the workplace, but school is a workplace, university is a workplace. We should be applying the same principle to schools, colleges, universities as they are applying in the enlightened employment settings of big offices. What does that mean? If we're going to reduce the density of mixing on campuses, school and college campuses, then we need to find out how to do that. We need to recruit the 30 or 40,000 teachers who qualified in the summer, who still haven't got jobs because there isn't a budget for them, so that we can have smaller class sizes. We need to be having outdoor classrooms put up, temporary outdoor classrooms, ventilated rooms on school playing fields, having smaller class sizes, having teaching assistants. We need to extend the school year, as I've said before, to December next year, to give an extra 4 months to enable those children who've fallen behind with their studies to be able to complete the curriculum, especially if they're doing GCSE and A-levels next year, so that they could take a longer time. And we need to be creative about finding other activities that people can do. Using the outdoor centres in the national parks, in the Lake District, in Snowdonia, taking on unemployed graduates who graduated in June who haven't got jobs to work with young people as part of organised youth and community work. Doing this kind of, there's no imagination in this government. We need imagination, we need creativity, we do need to keep education on track. We need to make sure that all the children have got access to the high quality remote online learning if they're going to spend part of the school week at home. We read last week that all the children at Eton have been tested for the virus. These machines cost £35,000. Ordinary state schools can't afford that kind of money. What we're seeing here is yet another gap opening up between private education and state education. What's good enough for wealthy private schools is good enough for state schools. Every school should have testing capacity, can be run by the school nurse in conjunction with the local medics. They need to be doing that. We've also read this weekend about rugby players jumping the queue for testing, using the lighthouse labs that are the ones that we're paying for billions of pounds, and the tests being done preferentially to ordinary members of the public waiting days for their test results so that professional rugby players can get their tests done before them. But this is not fair. We need to blow the whistle on this inequality and this unfairness that means people can buy themselves out of this pandemic when it's actually something that we're all in together. This country is great at coming together in a crisis. What we've had is people undermining that. We now need to find a path through to bringing everyone back again together to face the most difficult months of the year. That's what we need to do now. Anybody who doesn't do the right thing, who doesn't follow the guidance, the rules, the hygiene, the face coverings, the social distancing, you need to be able to look the relatives of people who die from this virus in the face and explain yourself. And you know, we are our brothers' keepers and sisters' keepers. We need to make sure that we keep each other straight on this one, because we're all in it together. We don't want to be blinded by corona for the next 6 months like we were in the first 6 months. A lot of these lessons are all there, you know, in my book, Blinded by Corona, which tells the whole story from January until the summer months, all the lessons, all the things we got wrong and what we need to do now. I just hope that somebody buys copies of this for each member of the government. But I'm sure your viewers will appreciate reading this as a tale of incompetence, of arrogance, and of dysfunction of government, Public Health England, and many of the people who should have known better, but succumbed to their own sense of their own self-importance and their unwillingness to listen. We must learn the lessons. We mustn't repeat them.